Hello everyone. I am Sanjana, onco nutritionist from ZenOnco.io. Today I shall be talking about nutrition for palliative cancer patients. Let us first try and understand what is meant by palliative care. So the term palliative has been derived from the Latin word which means pallium, and its meaning is masking. This etymology indicates what palliative care essentially is. It means covering or masking of the symptoms. Palliative care is more focused on the symptoms and the disease stress control for all the cancer patients. The main goal is to improve the quality of the life. WHO, or the World Health Organization, defines palliative care as an approach that improves the quality of the life of not only the patients but also their families who are facing the problems which are associated with the illness through the prevention and the relief of suffering by means of an early identification and impeccable assessment. Now, we know that cancer patients are at a high risk of malnutrition, and most of the cancer patients experience muscle wasting, which is a common consequence of anti cancer treatments. Now, this can also have a negative impact on the clinical outcomes as well, such as the patient might be at a risk of infections, and also they have experience or loss of appetite, and because of the treatment and the medications they also experience side effects or symptoms such as nausea, vomiting, diarrhea, or even oral mucositis. All of these can have a negative impact on their nutritional status because they are not able to take the adequate amount of food which is required, or the calorie intake is reduced as well. Next, in cancer patients, we also see that they experience cachexia. As earlier explained in one of the videos, cachexia is a multifactorial syndrome, and it results from the cancer treatment, the stage, and the multimodality treatments which they undergo. So what happens in the preclinical stage is that yes, there is an hormonal dysregulation which happens. There is also metabolic abnormalities which are seen, like insulin resistance, impaired protein and fat metabolism is also there. In the later stages, we see that they experience fatigue, there is early feeling of satiety and wasting as well. In cachexia, involuntary weight loss is a main hallmark. Now, it is also very important that we do nutritional screening for the cancer patients before treatment and also during treatment and after treatment as well. When we do an assessment to analyze their fat mass or their body muscle mass, nowadays there are advanced technologies which have been developed to also assess the body composition in the cancer patients. So these advanced technologies include CT and the MRI as well. Now, as I had earlier explained, that muscle mass also is a common consequence of the anti-cancer treatment. Loss of muscle mass is related to a poor tolerance to chemotherapy, increased risk of infections, and also it has an impact on the quality of life as well. The approach towards advanced cancer patients different. Okay, advanced cancer patients, the main aim is that we help in preserving their nutritional status, all right, during the palliative care phase. Now, in the late phase of the life, that is the refractory cachexia, wherein we have seen that the body is not responding to any kind of a treatment. So during this time, we see that there is a significant weight loss which occurs, and also there is a deterioration of the physical condition. So nutritional care should be such that it is focusing on the foods that the patient can tolerate and they prefer to eat within the aim of ensuring a better quality of life and reducing the symptoms. Now, in advanced cancer patients, we generally see that they also have difficulty in eating, they have dysphagia or difficulty in swallowing, also, they have a loss of appetite as well. So, now to manage these symptoms is something which is very important. So, what we need to do is the food has to be structured such that they get the optimal energy and the protein intake through the modifications which are made in the food quality, the portion sizes, and also the consistency of the food. Not all patients can have the same consistency of food. For example, a normal diet or a soft diet. Yes, there are certain patients who need to be on a liquid diet as well. Why? Because they have a difficulty in swallowing also. So now the first goal of nutritional treatment is to preserve with the oral nutrition by minimizing the food discomfort and also maximizing the food enjoyment as well. As per the ESPEN guidelines, counseling is the first approach with a nutritional treatment which is aimed at mainly managing the symptoms and encouraging the intake of the foods and drinks which are better tolerated. Conclude, yes, nutritional care for the palliative cancer treatment is very important. So we need to mainly focus on giving them foods and liquids which are best tolerated by them. So we need to also ensure that we are minimizing the food related discomfort and maximizing the food enjoyment as well. Thank you for watching my video. We at ZenOnco.io are always by your side while you are navigating through your cancer care journey. In case of assistance, you can surely reach out to our cancer coaches by the below mentioned contact number.